Welcome back to ACCEL for July 2016. I am Alfred Beauvais. Disc 3 begins with a discussion James Cheseboro had with Dr. Nancy Redeker, professor of nursing at the Yale School of Nursing in New Haven, Connecticut. They discuss disturbed sleep, aging, and cardiovascular disease.
Welcome to ACCEL.
Thank you.
And maybe you can tell us how disturbed sleep is not paid much attention to, and it involves many problems in cardiovascular disease.
So I think our awareness of sleep has been increasing over the last number of years in cardiology. When I started my life as a cardiac nurse many years ago, we never thought about sleep or that it might have anything to do with heart disease. But now there's growing evidence that problems like sleep apnea and insomnia, which are the two most prevalent sleep disorders around the world, may be important pathways to development of heart disease, including hypertension and the outcomes such as ischemic heart disease and heart failure. We also know that patients who already have those problems are at higher risk or likely to present with both conditions, and that they're not necessarily separate. They may be related, they may be unrelated. So about 50% in some of our work of patients with heart failure had insomnia. About 50% of those patients had sleep apnea, and they were not necessarily related one to the other. Unfortunately, while we're becoming more aware of sleep apnea, we're a little bit less aware of the broader area of insomnia and how to address it in cardiology.
So really, one of the questions all cardiologists ought to ask their patients are, do you have trouble sleeping? And if they have insomnia, then they ought to be tested for sleep apnea as one of the causes. But then they ought to be intervened upon and sent to a sleep clinic to have cognitive behavioral therapy to help improve their sleep.
So yes, I think we should be asking all of our patients about the extent to which they have disturbed sleep, and I would ask broadly about, tell me about your sleep, but ask about problems falling asleep. Does it take them half an hour or more to fall asleep? Waking up frequently during the night or waking too early in the morning, and all of those can be signs of insomnia. Waking up frequently at night can be a sign of sleep apnea. So we need to ask the question broadly and then follow it up with more specific questions. So for example, both patients with insomnia and sleep apnea may have difficulty awakening frequently at night, but the patient with sleep apnea is likely, particularly if it's obstructive sleep apnea, to have snoring, more likely to be obese, have a large neck size if it's a man, over a neck size of 16 if it's male, and over 15 if it's a woman. And also, do they have pauses in their breathing during sleep? Now, often the patient's family, you need to elicit that information from a family member or a person who observes the person asleep, because sometimes the patient doesn't know. Now, I think that we know that patients with heart disease or at risk for heart disease are at high risk for both of these conditions. So even once the patient gets treated for sleep apnea, they may still have this other condition called insomnia, which is defined as difficulty falling asleep, staying asleep, or waking too early. Those patients could definitely benefit from a treatment called cognitive behavioral therapy for insomnia, which has traditionally been delivered by a sleep specialist psychologist. More and more it's available through other sources at this point.
And then also, we always encourage our patients to have improved physical exercise, and this sort of thing can also help with sleep.
Absolutely. So a piece of the treatment when we do cognitive behavioral therapy for insomnia includes managing behaviors, including physical activity and exercise, including manipulating your bedtime environment, obvious things like making it more quiet and reducing the light levels, keeping your pets out of the room. You'd be surprised sometimes. Drinking less caffeine. There are many behaviors. Of course, we want exercise is an important way to reduce cardiovascular risk and improve outcomes for people who already have heart disease. When we talk about exercise in the context of sleep, however, we need to think about having people exercise early in the day, because that's the best way to regulate circadian rhythm, and try to do it at the same time every day, which is often difficult for some of us with very complicated lives. The data, though, however, on exercise and sleep, it's a sort of a common sense approach, and there are data showing that exercise improves the sleep, but it's not completely obvious how that happens, and so there is more research underway to look at that. But definitely the timing makes a difference.
Well, we also know that having regular exercise reduces the tendency for a rapid increase in sympathetic stimulation, which can also interfere with
Oh,
sleep
absolutely.
also.
Absolutely. And part of exercise, we also, in cognitive behavioral therapy, we use stress reducing techniques like progressive muscle relaxation. I have some research going on now where we're using music. So exercise is one way to reduce that sympathetic arousal, as are some other mechanisms that may have other cardiac benefits as well.
So also a sleep disturbance also interferes with medical therapies, and they don't always adhere to their medicines or their risk factor prevention problems.
There is increasing evidence, and it's pretty clear, that sleep disturbance of all sorts that contributes to short sleep affects our cognitive function. And oftentimes people are not even aware that that is so because they become accustomed to having less than normal cognitive function. And there are some pretty good studies showing that people who are cognitively impaired because they have disturbed sleep are at higher risk for non-adherence to medications and other therapies. What we don't know is if we improve their sleep, can we reverse that effect on adherence? So we need to do more research, but it is pretty compelling in terms of cognitive function in general regarding sleep of all sorts.
Well, this is very important information that I think is not included in cardiovascular care as much as it should be, and maybe you can give us some take-home points here.
So I think patients have told us, and these were heart failure patients, that they were concerned because they go to their cardiology clinic and the providers there ask about their medication and take their blood pressure and give them the pill, but they commented, nobody ever asked about our sleep. And they also told us they thought that was very important. So I think the first point is to ask about sleep and then to do something about it. And so in the case of cardiac patients or people at high risk, think very seriously about referring people for a sleep study, for sleep disordered breathing, but regardless of whether they have sleep disordered breathing, to think about insomnia, which is comorbid often with depression and other problems that we also know are bad for our cardiac status and daytime function. So ask about it, do something about it, as in referral, and once a patient is referred and gets treatment and they come back to your office or clinic, follow up and make sure that they're using it. We know that CPAP, for example, is an excellent treatment for sleep disordered breathing. We know that it improves cardiac function. However, the greatest limitation is that the adherence rates are very poor, and they're poorer, in fact, than many medication adherence rates. In fact, Medicare today will not continue to pay for a CPAP machine unless the patient uses it, and there's a smart card in the machine that counts how many times it was used. So they will follow up on that. But I think ways to know if the patient is achieving a treatment benefit is to ask them about their sleepiness. Do they feel better? Are they less sleepy? Are they less fatigued? Are they more awake to be able to go about their normal daytime activities? We already know that cardiac patients are impaired in terms of their daytime function. Treating sleep could be a very simple way to improve those other outcomes as well as their cardiac function.
Thank you for coming to ACCEL, and this is an excellent addition for treatment of cardiovascular disease.
Thanks.